I'm Ben Lockshin, a board-certified dermatologist practicing in the Washington, D.C. area. I'm the director of the Clinical Trial Center at U.S. Dermatology Partners, and today I'm speaking on Bimekizumab, which is FDA approved for individuals with moderate severe psoriasis and psoriatic arthritis. Bimekizumab brings us closer to achieving complete clearance in patients with psoriasis vulgaris. It also has, in my eyes, somewhat unparalleled results in terms of achieving high levels of improvement for those with psoriatic arthritis. It is the first drug that used the ACR 50 as the primary endpoint for psoriatic arthritis. And also, it used the primary endpoint of 16 weeks, which is 8 weeks sooner than any of the other biologic agents approved for psoriatic arthritis. In 8 weeks less time, we are able to achieve the same levels of clearance, if not better levels of clearance, seen with many of the other competitor drugs. In the psoriasis patients, we're able to see very high levels of clearance with the Q4-week dosing at 320 milligrams. As soon as 4 weeks, we see a mean PASI improvement around 80%. And what we see at 16 weeks, the primary endpoint in these studies, we see a high level of patients achieving complete clearance of their skin, where this data continues out through the duration of the studies. More importantly, in clinical practice, we see not only high levels of clearance in patients that are biologic naive, we also see very similar levels of clearance in individuals who have been on previous biologic or small molecules. Where I see this fitting into my practice is for patients with psoriasis vulgaris that is extensive, as well as the moderate to severe disease patients that are looking for virtual clearance or complete clearance of their skin. In terms of articulating side effects, I like to discuss the risk of candidiasis, which is almost certainly oral candidiasis, with a small percentage of people experiencing esophageal candidiasis. This, from my experience, has been very easy to treat, often with a short course of oral diflucan. Other adverse events that we see that are in the label include LFT abnormalities and suicidal ideation. When articulating this to the patients, I inform them that the rates that were seen in the clinical trials were consistent with the active comparator groups in the studies, and the rates of suicidal ideation and depression are consistent with background rates of patients with psoriasis and psoriatic arthritis, and also were consistent with the rates that were seen with the active comparator groups in the clinical trials. That being said, I do mention this to be able to control the narrative and discuss with the patients to reassure them, because I'd rather them hear the information from me proactively rather than having to address it reactively if they bring it up. Thinking about this medication holistically, I think that this really advances our ability to manage patients effectively with psoriasis and psoriatic arthritis, achieving high levels of skin clearance, which in my eyes translates into improved quality of life indices. Patients are able to achieve meaningful joint control in a quick and reliable fashion. In my eyes and from my experience, the ability of Bimekizumab to improve joints is the fastest I've seen of any products, and really looks at managing patients with psoriatic disease holistically. In summary, Bimekizumab offers high levels of skin clearance, and it doesn't matter if it's a first-line option or a second or third-line option. The results seem to be very consistent. And I think this drug really captures the essence of how we manage patients with psoriatic disease, incorporating not only skin clearance, but very high levels of joint control as well. So when thinking about patients with psoriatic disease holistically, Bimekizumab is an excellent option in terms of getting patients to where they want to be in terms of how they look and in terms of how they feel.